Welcome to the Practice Incentives Program Quality Improvement Report video. For the purpose of this video, we are using simulated data only. To keep up to date with our latest videos, hit the subscribe button and select all notifications. And if you like the video, give it a thumbs up. This video will assist practices to use the PIP QI report in POLAR. Open POLAR, select Reports, then select the PIP QI tile. The Quality Improvement Measures, or QIMs, have been produced by the Department of Health to allow practices to understand which patients may benefit from preventative treatments or which patients may need further intervention to ensure effective management of a specified chronic disease. There are 10 QIMs, or measures, which have been divided into a further 9 submeasures, numbering 19 measures in total. This report layout is similar to the clinic's summary report. In the dark ribbon at the top of the page, you will have the following: POLAR logo. Clicking on this will take you back to the Welcome to POLAR page. Report name. The name of the report and page name are shown here. In this case, we are on the PIP QI Clinic Summary Report. Reports menu. Clicking on this will take you back to the selection of reports available to you. The summary page is what we are currently on. Help also has a drop-down list with links to education and support features and the data mapping for each page. An in-depth look at the help features can be viewed in a previous video. In this report, the patient status filters active and RA-CGP active are applied by default. There are 3 sections in this report: the overview table on the left, the information in the middle, and the patient lists on the right. The overview table on the left-hand side includes the following headings: QIM group, metric, patient count, current proportion, trend. Under the QIM group there are 7 groupings: diabetes, smoking, BMI, influenza, alcohol, CVD, and screening. Hovering your mouse over the eye in the QIM groups will give you a full description of that QIM. Under the QIM group, using QIM 1 diabetes measure as an example, there are 4 submeasures: QIM 1.1 diabetes mellitus type 1, QIM 1.2 diabetes mellitus type 2, QIM 1.3 diabetes mellitus unknown or undefined type, and QIM 10 patients with diabetes mellitus with a blood pressure recorded in the last 6 months. If we hover the mouse over QIM 1.1, we can see that it is the proportion of regular patients who have diabetes mellitus type 1 and have had a HbA1c measurement recorded in the previous 12 months. Under patient count, QIM 1.1 shows 18 out of 28 of these patients have a HbA1c measurement recorded in the last 12 months. Current proportion gives you the percentage of patients that are meeting that QIM, which in this example is 64.29%. The trend gives you a visual display of how the practice is tracking in that QIM. Moving to the middle section, each QIM group from the overview table is displayed horizontally with an icon. Clicking on the diabetes QIM group will display the tabs for each submeasure. By default, it will open in diabetes QIM 1.1. A description of the QIM is located under the tab, which is the same description you get when you hover over the eye in the overview table. Underneath the description, there is a graph that shows the trend line by month for the previous 12 months. There is a description of the numerator and the denominator. For example, the numerator represents the 18 patients in the table who are active and RA-CGP active. They have an active diagnosis based on the SNOMED code for diabetes mellitus type 1 and have had a HbA1c measurement recorded in the last 12 months based on the pathology LOINC codes for HbA1c. The denominator represents the 28 patients who are active and RA-CGP active and have an active diagnosis based on the same SNOMED code. Please note, for practices using a billing system that is not supported by POLAR, the equivalent number of progress noted entries are used to calculate the RA-CGP active patients. In our example, to find the 10 patients that have not had their HbA1c measurement performed, you can click on the orange button. Click to select patients. The patient IDs and names will load in the patient list on the right-hand side. To print, select Patient List up the top right hand side. You are then able to export the list to Excel when the patient list loads. Before moving on to another QIM, clear the patient list by using the Clear the Patient List button down the bottom right hand side. Note, not all the graphs will show increases in the measures. For some of the QIMs, you will want to see decreasing graphs. An example of this is QIM 2.1 Current Smoker, which is the proportion of regular patients who are aged 15 years and over and whose smoking status has been recorded as current smoker. Open the Smoking tab. By default, this will open in QIM 2.1 Current Smoker, and you would expect to see a decrease in this measure if more of your patients are quitting smoking. If you found this video helpful, remember to subscribe to the MFIN YouTube channel and give the video a thumbs up. See you in the next video.